ever had a patient who was happy until they weren't? Now, dissatisfaction can come from different places and is often not just the treatment results. It's usually from the gap between what someone expects and what they actually experience. Whether that is a nervous patient who didn't feel like she was reassured enough, or a demanding patient who felt her needs weren't met. In this video, I want to share with you what you can do during each stage, before, during, and after the treatment, to reduce that gap and build stronger and safer relationships with your patients. It's also important to protect your energy, your reputation, and your confidence. I will also share with you how you can approach an already dissatisfied patient who may be upset, requesting a refund, or threatening to leave a bad review or reporting you to the higher professional bodies. But before that, I need to get changed to see a patient. Let's start with before the treatment. So during the consultation. Now, this is where the foundation is set. This is where you build trust, you clarify expectations, and you align their vision to reality. So what can you do? I'm going to ask them open-ended questions. What really bothers you when you look into the mirror? And how do you want to feel after your treatment? Let's look at some examples. Good afternoon. What brings you in today? How can I help? Hi, I just want to look fresher. Less tired, I guess. Can I ask, what do you mean by fresher? Is it a specific feature that makes you look more tired, or is it just a general feeling when you look in the mirror? I think it's under my eyes, and it just makes me look tired, and I don't like the lines around my mouth. I hear that a lot. I can tell it's really bothering you. And what we can do with treatments is just reduce those shadows and softens this appearance of those lines. But I have to be upfront with you. We won't be able to erase everything. And what I normally like to do is just build the results gradually so that it still looks natural, still you, but a lot more rested. During the consultation, it's important to underpromise and then later overdeliver. You want to clarify their emotional needs and not just their physical ones. Let's go into the treatment section. You'll feel some pressure and some discomfort, but it shouldn't be too painful. We'll go slow, and if at any time you want to stop, just let me know, okay? And remember to breathe, all right? Are you ready? It's looking a bit uneven. Is that normal? Totally normal. Right after treatment, there's swelling, so it can look uneven sometimes. It'll take a few days to settle down. What I'll do is I'll check in with you at the end of the week just to see how you're progressing. The goal of communication during treatment is to maintain connection, comfort, and clarity. Reassurance isn't about promising perfection. It's about being present, managing the moment, and setting expectations. Post-treatment, your role is to hold the space for your patients, maintaining communication, supporting integration, and managing any post-treatment doubt and regret. Now, you don't need to fix everything instantly, except if there is an actual problem. Most of the time, patients just want to be heard and gently brought back into perspective. Just checking in, how are you feeling today? Hopefully there's not too much pain, bruising, or swelling. Let me know if you have any questions. I don't know, I thought I feel better, but I'm not sure I like it. I really appreciate you being honest. It's still early, and swelling usually takes a few days to settle. I'll check in again at the end of the week. If anything still feels off then, we'll review together in clinic in a couple of weeks and make a plan. So what do you do when the patient's already disappointed? What can you say? The key is to communicate calmly and professionally, protect your energy and your reputation, and de-escalate where possible. Let's look at some common situations and how to respond. Situation number 1, I'm not happy and I want a refund. The key is to stay calm, avoid defensiveness, and don't take it personally. What you can say is, I'm really sorry to hear that you're not happy with the outcome. I'd like to understand more about what's bothering you so we can find a constructive way forward. Do not agree on refunds on the spot. Bring it back to the signed consent, treatment plan, and agreed outcomes. You can also add, as we discussed, outcomes can vary, and part of the process involves follow-up and reviewing results over time. Situation number 2, I'll leave a bad review if you don't fix this. The key is to diffuse the emotions first. What you can say, I understand this experience hasn't met your expectations. I genuinely care about my patients and want to resolve concerns ethically and professionally. Let's have a constructive discussion about the next steps. Make sure you maintain documentation of all conversations and screenshots of all messages. Never argue via text or direct messaging. You want to offer a phone or in-person review. Situation number 3. I'm going to report you to the GMC or your governing body. The key is to stay professional and don't panic. What you can say is, that's your right. And if you choose to do that, I'll cooperate fully with the appropriate bodies. I'll also be documenting this conversation as part of my records. You want to remain calm, do not retaliate, and document everything, and inform your medical indemnity provider immediately. In this last section of the video, I want to touch on the red flags that you need to be aware of, the importance of maintaining professional boundaries, and how to handle unreasonable requests. Now, I love this quote: "What you allow is what will continue." Not every patient is your patient, and your job is not to please everyone. It's to provide ethical, thoughtful care within clear boundaries. The more you trust your gut and communicate with calm, confident clarity, the less drama you will have, and the more aligned your practice will be. That's how you will build a sustainable practice while maintaining your peace. Let's look at some red flags to watch out for. When patients say, "I've been to 4 other clinics and no one gets it right," or they're constantly questioning your expertise before treatment, or asking for unrealistic results like, "Can you make me look like this celebrity?" Being overly fixated on one tiny feature, or saying, "I don't care about the risk, I just want it done." When you start getting a tight, nervous feeling in your body, I would say, just say no. Okay, if you want to sleep well at night. What can you say when your gut says no? I want to make sure we take the time to fully understand what's happened before and what you're hoping for now. My instinct is to pause and reflect rather than rush into treatment. How about we sit with this and reconnect in a few days' time? Or, "I really appreciate you coming in. I think it's best we don't go ahead today. I want you to take a little time to think it over. My door is open if you decide to come back." Or if you're feeling up to it, you can also say, "I don't feel I'm the right person to deliver what you would like to achieve. You have a unique face, and I don't have the experience to give you what you are looking for." What about unreasonable requests like, "Can you add a little bit more while I'm here? I know I'm late, but can you squeeze me in?" Or the worst one, "Can you do it cheaper this time?" I would say your energy matters, so protect it. What you can say is, "I'd love to help, but today's appointment is structured around what we initially planned. We can absolutely discuss the top up or future treatments, but not on the spot today. I don't offer discounts outside of promotion because I believe in fair pricing for everyone." My final takeaway is this: the best way to handle dissatisfaction is to prevent it from happening in the first place, as best as you can. It's not about being perfect, but being present. And if you ever had a difficult interaction and went home replaying every moment in your mind, doubting yourself, and wondering what you could have said or done to make things better, you are not alone. That was so totally me, a natural worrier and people pleaser. It's natural to feel that way, especially being in an industry where we care so deeply and want to do right by our patient. But don't spiral into self doubt. The fact that you're here learning and growing tells me how brave you are and committed to take care of your patients. I tell my students this: it takes a lot of courage to start something new, to build a business, and to hold people with care while finding your own 2 feet. So if no one has told you this lately, I'm really proud of you. When was your last difficult interaction with a patient? How did you handle it? And after learning the lessons from today's video, what would you do differently? Let me know. I would love to hear from you. If you found this video useful, hit like and subscribe to learn more soft skills, be a better practitioner.